Hey everyone, Allie here. As promised, I'm going to tell you my infertility IVF journey. It's been a while to get to this process of wanting to tell my story, but I kind of had to organize my thoughts. I wanted to get to a certain week in my pregnancy too, just to make sure everything was okay before I tell this story. Before I start my story, I just want to say I'm doing this in hopes that it helps someone else that's going through similar things, or somebody that's thinking about IVF, or just help someone understand infertility, IVF better. Obviously, I do not have all the answers. My story is not going to be like somebody else's story. My story is unique to me and my body and my husband and all the things above. But sit back because it's a long story, so this will be in a couple different parts, but I'm doing this so one that I remember, and like I said, for other people. So I'm going to try to be as sensitive as possible, try not to be as graphic as possible, because anybody that's gone through infertility, IVF, miscarriage, anything like that, they know that there's things that happen that are not necessarily like pretty, or I don't even know what the word, that's not even the right word, that are more graphic than obviously not. So let's get started. I have my list of everything that I kind of went through and dates and stuff like that. So I'm going to be looking at that and kind of just telling you all my story. Hopefully I don't go too much on a tangent, but certain things, might hit a hot button and I might have stuff to say about it. So anyways, let's get started. So, first let me start by, I am doing this at 27 weeks because I wanted to get to a certain spot and I had other stuff that I needed to do. And, I just had to be in the right frame of mind to talk about this like many other people are. So every day is still prayers and good vibes to get to the end. As anybody else that's just pregnant in general, not necessarily IVF or infertility, there's things that could happen and everything. So, yeah. So, still hopeful, almost at the end of this journey, and we are excited about this journey. I've already announced that I'm due in June. June 6th is 2024 is my due date, but I'll have to have a C-section, so I'll have to go a little bit earlier, and I'll talk about why I have to have a C-section in this video. And yeah, there was something else I wanted to say, but I can't remember, so let's not ramble. This has been a 3-year journey for me, so by the time that baby girl Yates gets here, it will be 3 years since the start of our IVF journey. Not the start of infertility journey, but the start of IVF journey. There have been some breaks in between there, but basically from start to finish, it'll be 3 years. So I'm in Kentucky. We did everything in Kentucky, and there are IVF facilities all across, the United States, all across the world. So, but ours is specific to Kentucky. I don't remember exactly the date or whatever when I felt like I had infertility or whatnot. I know that about 13 years ago, this June, June 2024, 13 years ago, I had a myomectomy to remove fibroids. I can't remember how many, but there was quite a few, let's just say 6 or 7. One was really big. I remember my doctor showing me it was the size of like a golf ball, maybe even a little bigger, that a bunch of fibroids clumped together to make this big one, and I could actually kind of feel it. So my first myomectomy was 13 years ago. I probably should start by saying that I will be 41 probably by the time this goes up, or a little bit after. I will be 41 by the time the baby gets here too. So later in age, obviously, harder to have kids, more infertility problems. Also, in my research, I've learned that women of color are more likely to have fibroids, which is one big thing I'm going to talk about with me. And if they have not had children before a certain age, like a younger age, and it didn't really say what age. So my first myomectomy, which means removing fibroids, was 13 years ago as of June 2024. So, fast forward from that, had my myomectomy, did my thing, went to work, whatever, wasn't necessary. I don't know, dating anybody or whatever, not married or whatnot. So, years later, met my husband. We got married September 22nd, 2018. And maybe like about 2020, we started really discussing kids because we weren't young. He's 10 years older than me. I am, like I said, I'll be 41. So now in 2024. So we both really said that we wanted kids, or at least have one kid. So we started that process, and obviously we started, like most people start naturally, wasn't really working. I went to the doctor, my regular gynecologist. I knew I still had, I had fibroids again, but I didn't know that they had gotten as bad again, which I probably should have known because I had heavy menstrual cycles, and that's like a huge sign. And if you have like cramps and pains and stuff like that, that could be a sign as well. So I went to gynecologist. She said, since we've been trying for a certain amount of time and obviously advanced age, that she would recommend that I see a fertility doctor and talk about what was going on, but also see a fertility doctor because I had fibroids. And this doctor that I had now, my gynecologist, did not, I don't think she did myomectomy. She might do them now, but she didn't. She was like newer then, and I had, my old doctor had retired, and she was the new one coming in, and she didn't do them as of then. So she recommended a couple fertility doctors to me, and it takes a while to get into a fertility clinic depending on where you are. The one that I went to, it took a while. Here in Kentucky, a lot of people go, I live in Louisville, Kentucky, a lot of people go to Cincinnati for fertility stuff because there is a clinic there that has multiple fertility doctors and you can get in quicker. I wasn't opposed to that. I just kind of wanted to stay close to home with work and all this other stuff. And we weren't necessarily in the rush, but we should have been in the rush. So I had my first consultation with the fertility doctor, which was virtual, on May 2021. So that's why I say when the kid gets here, it will be 3 years from the first consultation to birth of a child. So first consultation was fine. Got me in the next month, June 2021, for a sonohystogram. If you've never had one of those, it's the dye test where they basically shoot dye into your uterus to look and see if the path is clear and see if there's anything obviously blocking it, fibroids or any endometriosis or anything like that, that was blocking it to cause you to have infertility and not become pregnant. Didn't love that test. It makes you cramp a lot, but worth doing it. Looked at it, saw the fibroids. He didn't say yet myomectomy, but he wanted me to do a polypectomy, because I guess there was a polyp inside the uterus where the egg would implant, and didn't want that to hinder anything. So July 2021, I had a polypectomy surgery. It was outpatient, quick recovery over the weekend. So after that, I thought, good to go, good to start kind of the real IVF journey. But my husband and I decided that we were going to wait a little bit because we wanted to figure out how we were going to pay for the IVF, whether we were going to pay out of pocket. Our insurance at that time didn't cover it. Like, what were our avenues to be able to do that. My husband did not want to write a check for this, and at that time I didn't understand, but I understand now, because you can write a check for something and then you have nothing to show for it at the end. So I commend him for that. During this process, you have a lot of blood drawn. The phlebotomist that we would go to at our fertility clinic said you all should there's a lot of companies that pay for it. Some, look into companies that pay for it or whatever, like Amazon, I think Starbucks, some other stuff, some other places. I know for sure I can say Amazon pays for it because that's the route that we went. Now, I can't 100% say that other corps pay for it, but I know there are some out there, so just do your research. The insurance at Amazon is amazing. Shout out to Amazon because they're really the ones that helped get us over hump into the next level. And shout out to my husband because he's the one that did that work to be able to get us here. So my husband kind of went to work for Amazon, including his day job, just because this insurance was very, very good. So polypectomy, July 2021. Then my husband started working for Amazon February 2022. So that's when, and then I think you have to wait a month or whatever. So then called and made an appointment after our insurance was good to go. And then I don't know when my first appointment was. Let's say it was in March. They just did, I think, an ultrasound or whatever. And then April 2022, I started shots and medicine for the egg retrieval. I won't go into too much detail about that. Anybody that's gone through IVF knows about the shots and things like that. You have to give them to yourself or you have somebody give them to you. I did my own shots because, one, that's what I felt comfortable with. I didn't even ask my husband. He does, I don't know if he's even given shots. Some people have other people give them shots, but I personally just did it myself. And yeah, it's not fun. They make you nauseous. They give you headaches, basically. Essentially, it's hormones, but you got to do what you got to do. So that was April of 2022. May 2022, I had my egg retrieval. So in between April and May, had many ultrasounds just at my fertility clinic because they look at your uterus, they look at your ovaries, they look at how many follicles and things like that. And in between that April and May, I was giving myself shots every day. I can't remember if it's day or night. It could have been both, whatever. And then you also, I think, take some pills. And everybody's protocol is different. So that was just mine. So egg retrieval, May 2022, went to the fertility clinic. They put you under some local anesthesia. They go in and get eggs. We got 7 eggs. A lot of people get a whole lot more eggs than what I got, but advanced maternal age or whatever you want to call it, they got 7 eggs. So with this insurance, we were allowed to do genetic testing on the eggs. So from 7 eggs, we went down to 3 that were viable, that became embryos or whatever. We made sure that everything was good with those. They shipped them off, and froze them. Yeah, they freeze them. They ship them off wherever they do or whatever, if they do it in-house, and then they freeze them. So I was lucky, and we were happy to be able to just have one egg. So 3 we were happy to start with, and we knew what they were and everything. So that's one of the benefits of genetic testing. If you want to figure out what your embryos are, you can do that. Other things of genetic testing is that you can figure out, like, if there is if your eggs are not that great, or if they're not viable, or things like that, you can find out that. So start after egg retrieval, you have to recover. I think it's just like a couple days. We can process whatever. That day they tell you just go home and rest, and I think you can go back to work the next day. I can't 100% remember, but I'm pretty sure. That was May 2022. So June 2022, I started the medicine for transfer. That's more shots. That's more oral medicines and things like that. Yet again, makes you feel like crap. It's hormones that you're shooting up, and that's all I'm going to say about that. If you don't like shots, the IVF process is full of them. And not to mention, which I haven't really mentioned, every time you go to the office, because there's office visits all through here where you get ultrasound and then you get your blood drawn. So there's a lot of like getting your blood drawn too for shots like that, because they have to check your levels of hormone levels and iron levels, make sure you're healthy and all and everything like that. So started medicine for transfer June 2022. July 26, 2022, I had my first transfer, my very first one. So when you do a transfer, you have to wait. They call it the 2-week wait. I think mine was like 9 days of where you have to go in and get a beta on that 9th day or that 2-week day to find out if you're pregnant. Some people test. They tell you not to test. Most times they tell you not to test, but you know, the mind wanders after a couple days if test. I think I did test. It came out negative, but that didn't necessarily mean I wasn't pregnant, because it could have been too early or whatever. So went back, and I didn't have a lot of symptoms. A little bit of nausea, but not a lot of symptoms during that first transfer. Went back August 2022, so it would have been 9 days after July 26th, so it was in August. Found out that my first transfer failed. So my beta barely even registered. I think she said it was maybe like a 0.01 or something, basically meaning I'm not pregnant. It didn't register at all. I mean, I think, and don't, like I said, I'm not a doctor, don't quote me on it. If it's like under a certain, like 4 or 5 or something like that, it means you're not pregnant, maybe. But if it's very low, it's either not going to be a viable pregnancy or you're not pregnant. So obviously that was a bummer, but I felt, and I think that was the one that may have, for me, hurt the most, because in the very beginning, you don't know what to expect. And you also have your hopes up that, oh, this is just going to work. Right. And it didn't. And, you know, so you have all these hopes and dreams that everything's going to be great. And then it didn't, because it's the first time I've ever went through that. So I've never had a miscarriage, never been pregnant, didn't even, you know, so it's like, oh, this is gonna work and it's gonna be all good. Like, very naive. Don't go in naive, because it usually takes multiple transfers for you to get pregnant. But it didn't work. And so after that, you gotta, you know, let your body have its first period, flush out all that stuff. Wasn't taking anything, got off all the medicine. Had your first period from that. And then the periods after you have this stuff are awful. Just FYI, they are awful. So then September 2022, my doctor wanted me to do an MRI on my uterus, because you can only see so much from an ultrasound, where you can see a whole lot more from a uterus. You can see so much more from an MRI. And I'm thinking, because I'm about to say something about my uterus. So in that MRI, they found out I had 17 fibroids. They knew I had fibroids, but they didn't know how many, because it was hard to count and you couldn't see them all. 17 fibroids and a tilted enlarged uterus. Yeah, so my doctor gave me a couple options after that. He said, you can just try another transfer. So that means I have 2 eggs left. It may not work. You can have another myomectomy, remove whatever fibroids we can remove. 1, for a better quality of life. 2, for a better transfer and hopes of it sticking. And I need to say that when I did the transfer, which the first transfer was horrible. Like, my first transfer hurt. It took a long time. And it's not supposed to be like that. Most people transfers really quick, but since I had an enlarged tilted uterus, it was hard for him to get the transfer in there, and it wouldn't come off the needle, the rod thing. So he had to do it like 3 or 4 times before it actually went in there. So, and it was just, my husband was like, because I couldn't see the doctor's face. My husband's like, the look on his face looked like, yeah, this is harder than expected. So, so 1, have another transfer. For 2, have a myomectomy, better quality of life, easier transfer, more likely for, hopefully, the embryo to stick. Or the third one, which he said we are not there yet, would be to have a gestational carrier, is that the right word? Have a surrogate, basically, with your eggs or whatever. He said we're not there yet, but that's always there. So we decided to do the myomectomy. All right, so I had myomectomy October of 2022. Had to spend 3 days in the hospital. Painful if you've ever had a myomectomy. I think he got 5 or 6 fibroids. There was one that was by my bladder that he did not want to get because he didn't either think he could get it or he didn't want to cause any other issues. So that one was still there. And then the other ones were like smaller ones or weren't going to affect the transfer. And he got as many as he thought would affect the transfer and that he could get. The surgery was still a long time. I think it was like 5 or 6 hours, but it was a long time. 3 days in the hospital. Then recovery about 6 to 8 weeks, probably more around 6-ish. Was on no medicine, just like some pain reliever or whatever, but was all off the IVF medicine and all that stuff. He wanted to give my body a break during that time and just kind of a reset, have a normal menstrual cycles and things like that. So recovered from that, and then on January 2023, we had talked about this in December. He wanted to put me on Lupron, and Lupron was a shot that I took once a month for, I think, 1, 2, 3 months maybe. And I started that January 2023. It, like I said, once a month, and it was to help shrink that fibroid that was by my bladder so that the transfer would be easier. So I started that. I did my first shot in January, the second shot February 2023, third shot March 2023 of Lupron. And then in April, he brought me back into the office, had another sonohystogram, which was the dye test, see if everything looked like it was working correctly. There was no excess tissue, whatever, scar tissue. Also, that surgery that I had in October, there was some scar tissue left from like the first surgery, so they cleaned that up and everything too. So that's another reason that it took a long time. And so, myomectomy, yes, it's painful, but if you need it, then I would suggest doing it. I've had 2, don't love it. I haven't found any other way to really shrink fibroids if you have a lot of them, especially if you're trying to get pregnant. So anyway, sonohystogram, April 2023, everything kind of looked okay. Didn't have to take another shot of Lupron. We also discussed, since he had a hard time doing the transfer, like getting the embryo to stay in there as he was doing the transfer that first time, putting a stitch on my cervix. So we did that May 2023. Yes, hurts, needle. It's very quickly, needle, put a stitch there. And that usually happens like a week to a couple days before, maybe not even a week. It might have been like 4 or 5 days or 3 or 4 days before. So after the stitch, May 30th was the second transfer. So between that stitch, probably right before that stitch and the transfer, I had to go back on the transfer meds, which I think they do that 7, 8 days before, maybe a week before. I don't remember the whole timeline, but it's not a long period of time where you have to start doing the shots for the transfer and then some medicine for the transfer and things to soften up your cervix and all this other stuff, so it makes the transfer easier. So did the shots and stuff for that. May 30th was my second transfer. Husband and I were delighted to have the second transfer, and thought that, this probably was our best opportunity to get pregnant and have a viable baby and everything like that. As you're going through this journey, there's not a lot of people that talk about their IVF journey. So there's not a lot of people to actually, talk to about it. A lot of people on social media kind of talk about it. And, I was following some of them. I found a couple people that had some infertility problems. Kind of, we kind of, talked here and there. One girl and I went to lunch a couple times because she was having issues and she was doing IVF as well. So after the transfer in May, we had to do the 2-week wait again. I did take tests. They did come out positive. I was happy, ecstatic. My husband really didn't want to know what those tests said, which was fine. But I felt a bit different than I did the first time. A little bit more nauseous, I guess more optimistic or whatever. So my betas were June 8th. So transfer May 30th. First beta was June 8th. It was 109, which was said to be good. The second one was June 12th, 2023, 561. So it's supposed to like double, and it did. And third was June 19th, and it was 4,016. So all good, great numbers. That's what they told me, obviously, because I hadn't had beta numbers before. I had the beta that didn't register. So I didn't know, besides, Googling what the beta was supposed to be, but they told me great numbers, everything looked good. They were excited. We were excited. We thought this was meant to be. But June 26th went in for ultrasound, and I think it was the sac or whatever was measuring smaller, and possibly there may be not a baby in the sac. But the doctor didn't call it then. He wanted to give it a couple more days. So we went back the end of that week of June 30. So that was June 26th, first ultrasound. June 30th, second ultrasound. And it looked exactly the same. He said I was going to have a blighted ovum miscarriage, which basically meant no baby in the sac. And my husband and I were both like, well, how can this happen if we've had genetic testing and these eggs were supposed to be viable? So we asked all the questions. Basically, we're told that this happens sometimes with IVF. This happens sometimes, without IVF, when you get pregnant regularly. So basically I was going to have a miscarriage, which wasn't good news, obviously, at all. We were pretty much devastated. Weren't happy about it, but I felt like this one didn't hurt as much as the first one. I'm not sure why, because I guess we were just so much more used to disappointment with this situation. We also knew we had another egg, so there was also another chance, but then you think, oh, we only have one more egg. So talked to the doctor. He said, you can either have a D&C, you can have a natural miscarriage, or, I can choose what I wanted to do. Well, we wanted to do the D&C because I didn't want to go through any more pain. I never had a miscarriage, didn't really know what to expect. I know there's bleeding and things like that, but we wanted the D&C. But come to find out, that was on a Friday. My doctor was leaving to go on vacation that Saturday, so he had to schedule the D&C for a week and a half. Yeah, a week and a half. Almost 2 weeks, basically, from when he told us that I was going to have a miscarriage and telling us that I needed to come off the medicine. So the medicine that you take after the transfer helps keep in your baby. So if you've ever had IVF, you have these other medicines that you take, progesterone and stuff like that you take, that helps keep the baby snug in there and for you hopefully not to have a miscarriage if everything is still viable. So basically told me to come off the medicine. He was going on vacation and I had to wait a week and a half. So that was a huge bummer, thinking about, hey, there's I was actually glad that there was not a baby in there if I was going to have a miscarriage, because I can't fathom having to wait for a week and a half, 2 weeks, and there's a, a non-viable baby that's still in my body and stuff. So I was actually glad, if that makes sense, because it doesn't really make sense, that there wasn't one in there. So that was on June 30th, right? Yeah, June 30th. I ended up having a natural miscarriage because after you came off the medicine, there's nothing helping you hold it in your body. And I had a natural miscarriage while he was on vacation, July 5th. So I started bleeding that day of July 5th. And there's no information, like, nobody tells you, hey, only thing I got, they told me to call them and let them know if I started to bleed. So I started to bleed, didn't really know. I was like, do I go to the hospital? What do I need to do? And they told me that I didn't need to go to the hospital unless I was filling up a pad an hour with blood. At that point, I was not. It started to become painful as time went on. Like in the very beginning, it's just like you're bleeding, kind of like little period cramps here and there, whatever. And that started early in the morning, let's say like 9 o'clock. As the day progressed, more bleeding and more pain, like very, 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 very painful. Still wasn't filling up a pad, but obviously you're getting rid of tissue that's passing through, and you just have a lot of bleeding. And I will just leave it at that. But super painful. Come, like, let's say like 9 or 10 o'clock at night, I was like doubled over in pain. Like, I really didn't sleep that night. It was the worst pain I've probably ever been through. Do not wish it on my worst enemy. Hope nobody has to go through a miscarriage at all, especially naturally like that. So, passed all that through. I'll just leave it at that. Passed all that through naturally, but it took days for me to kind of stop bleeding. It wasn't like, oh, just like 24 hours, 12 hours. It's a couple of days that you were bleeding till you finally stop. And it made me think, one of my friends, her partner had passed away from cancer, and she had made a comment after he'd passed away that the world was going on without him, and it was like very weird, and she didn't understand why. Not that she didn't understand why, but it's just like this understanding thing. It's kind of like I guess a grief and going through the motions type thing. Maybe not the motions, but you get what I'm saying. And I totally understood that, because it was like, okay, I'm having a miscarriage. That first day was like the worst, and you're not out doing stuff. But then the next day or 2 days later, whatever, you have to get up and you have to do your regular things. And it's not like you lay in the bed. Remember I was walking my dog, and like people are just, doing their things. Kids getting on the bus or off the bus, people walking, doing this, whatever, driving. And it's like the world is still going on, and you're going through this, but nobody knows. It's like, it's very weird. It's like I'm walking my dog, but I'm having a miscarriage, and the world is going on. So just to give you a sense of kind of what it feels like, that's what it feels like. To me, that's what it felt like to me. So it was very weird, and I totally understood what she meant when she said that after I had been going on. And I think I told her that. So, the doctor had come back and wanted me to, July 5th had them started the miscarriage. July 8th, I don't know when he came back, maybe the day before, I went in the office and they did an ultrasound just to make sure that I didn't still need to have a D&C, because I think when you have a miscarriage, especially, and maybe in my case, since it was a bladed ovum miscarriage and there wasn't like extra stuff in there, like a baby or something like that, that I passed everything through. Whereas like maybe some people don't pass everything through and they still have to have a D&C to get rid of everything, because obviously you don't want to leave that in there because of bacteria and everything. So that was a blessing that I didn't have to go through another procedure after I had already went through all of this. So I took some time after the miscarriage and everything, just to kind of get my life together, husband and I figure out what we wanted to do next. With our insurance, I had free virtual therapy appointments, or maybe not free, but like very discounted. So I took that up and had a couple of those just to kind of talk through what was happening, what my thought process was. And I totally suggest that to anybody that has infertility, has had a miscarriage, thinking about IVF, or maybe not thinking about it, but actively going through IVF, because it could be very lonely and very I didn't feel necessarily that it's lonely, but I've heard a lot of people say that it can feel very lonely and isolating because people don't necessarily talk about it. It's still somewhat taboo. More and more people are talking about it now, and that's why I wanted to talk about it, because I want other people to open up about their journey and what they had been through, because it could be very healing to yourself as well as other people to hear that they are not alone in this process. And so many people go through infertility. So that's why, that's why I'm doing this. But yes, have somebody to talk to, therapist, significant other. Significant other is good, but they're also going through something as well in the process. So, they might want to talk to somebody as well, and you all are already talking to each other, but you might want to have another person that you can just go talk to, or they can just go talk to. So that's my soapbox on that. So went and had another third sonohystogram, which was August 14, 2023. This one was the least painful. It's not painful. It's very like crampy. That's what it is. They're shooting stuff up and it's very crampy. I think they tell you to take like a Tylenol or something like that before, but it's very crampy. Everything looked good. Nothing, was left over. Everything looked good according to my uterus, tilted, enlarged, whatever. So, well, let me back up. Everything actually did not look great. Everything looked good. So there was another polyp that they wanted to get. So that was like something minute. So we scheduled another outpatient surgery at the hospital, August 24th, 2023, to remove the polyp. Let me just tell you that surgery was easy. The surgery was the easiest. The hard part of that was, so I went to, and it was a different hospital than we went to before, only because we couldn't get into our, the hospital that we really did. And so, got the IV started, whatever, and then go get wheeled down to surgery and find out, I don't know what it's called, but my arm got very enlarged with fluid, because I guess the IV wasn't put in correctly, and it took them forever. I got that one out. It took them forever. They stuck me, I don't know, like at least 8 times to get an IV going, and that hurt worse than actually having the surgery. Honestly, my doctor said, because obviously it's not my doctor doing, it's either a nurse or either the anesthesiologist or whoever doing it. He was like, after we finally got it in, he was like, okay, now for the time for the easy part. So then the next day my arm was like so bruised. So I know that's not necessarily part of this process, but it was part of my process. And yeah, you just got to go through a lot. So anyways, had the polypectomy, had to, just recover over the weekend. Nothing huge or anything like that. Waited for like a week or two, then probably started on the, I think my doctor wanted me to do a couple little Lupron shots as well. So did a couple of those. I don't have those dates written down. Did a couple of those, and it wasn't like a once a month thing. It was like a smaller amount. And then started the transfer shots and the medicines again, and that would have been the beginning of September. And then September 12th, did another stitch in my cervix. And then we were off to having our third transfer. Now, mind you, last embryo, third time doing all of this again. My spirits weren't as high. My optimism wasn't necessarily as high. And at this point, I started to dislike going to the fertility clinic. When you've been to someplace so many times and there hasn't been necessarily positivity, not from the staff, but positivity or things going your way with your body and things that you want, you don't really want to go back to places like that because it just reminds you of past stuff. But I also told myself that we had one more egg, and there's no sense in me not trying with this egg, because what are we going to do? Just sit there and be paying $600 a year for one egg to be frozen? Because that's not what we're going to do. And then let me go quickly back of a thought that I just had. So when I had that myomectomy in October 2022, I'm not super religious, but I do believe in God, and I do, or a higher power being, whatever. And I know I usually feel better sometimes when I talk about that, and that's that. But the doctor said to me, and I think they say this to everybody, it's just like a disclaimer, that if we can't, there may be a chance that we have to take out your uterus if we can't stop the bleeding or if there's other complications. So I don't think he just said that to me, but I think that was like a disclaimer. And I also had a thought before then, not at that specific time, that if I'm not supposed to go through this, or if I'm not supposed to have kids, there would be some kind of sign. And to me, like, that would have been obviously a surefire sign that this was not supposed to happen, or I was not supposed to actually have a kid. Maybe this way, it could be I can have a kid another way, like adoption or something like that. But it would have been a surefire way to say, nope, Allison, that's not it. So anyways, did the surgery, woke up, uterus still intact and everything. So there's that. So back to the third transfer, where this was the last egg. To me, that would have been another sure sign that if this didn't work with this last egg, that I was not supposed to have a kid in that way, shape, or form, and maybe in another way. So did the transfer on September 19th, 2023. Husband and I went, and it's just like, deja vu. Honestly, that's what it is. It was deja vu. Same room. And I dislike that room that they do. It's the same room they did the egg retrievals in, transfer rooms, because no good thing for me, maybe besides getting eggs out, had happened in that room. And it's supposed to be a sterile environment. It's like white. It looks like not an emergency room, but a surgery type room. So didn't love the room. Gives you a bit of anxiety. I had a bit of anxiety, going in there, because I know what I was in for as far as the pain, tilted uterus and everything like that, but did it anyway. So say that to say you got to keep pushing yourself forward to kind of get what you want. You can't just quit because of pain. Honestly, you got to go through some pain to get what you want on the other side. Transfer, he did the transfer. This was probably one of the easiest transfers. Stitch worked, removed the stitch. He was like, I don't know if he said third time's a charm, but I think we were all thinking hopefully third time's a charm, because when was this? So I was 40 already. So 40, didn't know if we went and tried to do more egg retrieval, because I didn't get that many eggs the first time, if I would be able to get more eggs if this didn't work. So that's always a thought in the back of my mind. I think that was a thought in my husband's mind. And I'm sure the doctor was like, hopefully this works because you never know. So anyway, waited for the 2-week wait, took some tests, and I was actually scared to take more tests this time. Not the second time, I wasn't, scared to take tests, but I was kind of scared. But they came out positive. Had a couple signs and symptoms. And this whole time I've been pregnant, I've never thrown up, but I've had some like nausea and stuff. I had some headaches. But also, let me tell you that the medicine that they put you on, the progesterone and all that other stuff, it's supposed to simulate that like you're pregnant. It makes you nauseous. It makes you have a headache. So you don't really know what's what, but did have signs and symptoms. First, a beta was September 28th, 2023, 172. Second beta was October 2nd, 913. So very good numbers, even better than the first one. Third beta, October 9th, 6,306. So we were like, okay, good. Then comes the day for the 6-week ultrasound. And it was October 13th, 2023. So this was that appointment, that second go round, that it measures smaller, didn't know if there was a baby in there, so felt some type of way about it. Had some anxiety. I'm sure my husband had some anxiety because, like I said, if you've had something happen before in that same instance, doesn't necessarily mean it'll happen again, but you're more alert, more aware, and you just, you have your feelers up. So I went in, and that was the 6-week appointment. It was 6 weeks in one day. So how they measure pregnancy, by the weeks. There was a heartbeat. There was a baby. Thank God. So that is the baby that I'm actually carrying right now. Still, we didn't get super excited about it yet, because if you've been knocked down before, you already, you can't get super excited about things, and you don't, you just kind of have your wall up. But it was a good day. We didn't like celebrate or anything, but it was a good day. We went back for another ultrasound, 8 weeks in one day. Everything looked good. Everything looked good from that day. And that's the day, which was October 27th, 2023. I graduated from my fertility clinic. Talked to the doctor. He did say, he's excited. We're all pulling for you. The staff was too, and I think they all were. Especially the lady that was the phlebotomist. Every time, because you see her all the time, because when you go in, you always have your blood drawn. She's always there, and she was super nice or whatever. Gave me a big hug. So after that, I graduated from the fertility clinic, and then I could start going to my regular gynecologist. And we have pretty much been there ever since. Everything has pretty much been good. It's been right on track. Feel movement, baby's doing good. We've had our anatomy scan, we've had a heart scan, we've had all the blood drawn and everything like that. One thing that I wasn't a super fan of once we started going to my gynecologist was, this is always like an advocate for yourself. We talk about, don't just go off what the doctor says. This is your body, this is your baby, and your significant other's baby. So advocate for yourself is so when I went to my first appointment with my gynecologist, which I hadn't seen in 3 years. Well, no, it wouldn't be 3 years. It'd be 2 years. 2 years, maybe 2.5. Is that they did blood tests and all that other stuff. Coming to find out, I was pretty much healthy before I got pregnant, and they did a bunch of tests. They took a lot of blood work. My A1C was high, and glucose level, A1C, basically diabetes, was high. I have it kind of run one in my family. But let me say this. So this was done in November of 2023. That's when I first went to my gynecologist. I had a miscarriage July 2023. After that miscarriage, I ate like crap. Sugar, candy, wine, carbs, ate like crap. Most people do when you're going through a tough time. I think it's either one or the other. You either don't eat or you eat a lot. I ate like crap, and I'm just going to put it out there. So I try to tell my gynecologist, this is where this is coming from. I don't really think that I obviously my numbers say that I have diabetes, but I think this is coming from all of those IVF shots, because if you know one thing, IVF shots are basically hormones. And when your hormones, this is what the diabetic educator, not my doctor, told me. When your hormone levels rise, which they do when you're pregnant, very high, then your sugar levels rise. And if you're eating crap like sugar and stuff like that, your hormone levels are already high, your sugar levels are already high, then your A1C is going to be high. So this is what I tried to explain or talk to my doctor about. She wasn't listening. She immediately wanted to put me on insulin. Like, would not listen, didn't care what I have to say. I asked if I could have a couple weeks to combat this problem by stopping eating crap and start eating healthy. She was like, no, no, no. So I got the insulin. I got the monitor, whatever, all that stuff. Spent a lot of money, but didn't start taking the insulin. I started changing my diet a lot. This is before it could be gestational diabetes. This was early on. So this was probably like 12 weeks, maybe even like 10, 11 weeks, because the last appointment with my fertility doctor was 8 weeks. So just ate great, like I literally cut out everything. I wasn't eating candy. I wasn't eating, whatever. Went to the diabetes educator. She told me eat like this, this, and this, have protein and all that. I won't go into that. My numbers dropped like a lot. And I still, my gynecologist or whatever still thinks I'm on insulin. Never took insulin a day. Have not taken insulin till this day. And my numbers are still good. Still eating healthy. I mean, I've added some sugar back in, but still eating healthy. And so when I had the heart scan doctor told me for the baby that two reasons why you don't want to have diabetes or you want to control your diabetes when you are pregnant is, one, your baby you could have a heavier baby, like a bigger baby, if you have diabetes. And two, it's because the baby could have heart issues, and the heart issues would start very early, like around before 12 weeks when the heart is developing. So he did all that stuff. I hadn't been on, and this happened around week 20, let's say 23, 24. And he did the heart scan, and he's like, the heart looks great. Everything looks great. And then he asked me when I got this diabetes diagnosis, and I told him, and he was like, well, yeah, it should have been. He was surprised that I even quote unquote had diabetes, because all my other numbers look great or whatever. And I just left it at that. I'm still not on insulin. My baby is thus far normal size, not a big baby. And my sugar levels are pretty good. I have to send them in anyway. They still think I'm on insulin, but this is when people are trying to push stuff on you. And this is not me telling you not to do this. This is just me telling you my stories. Advocate for yourself. Do things that work for you and my husband and I both talked about this, and I'm going to keep you all updated on that part, because I'm pretty sure after I have this baby, my A1C levels are going to be pretty, not low, like super normal, because they were before I was pregnant. So I just wanted to throw that in there. Also, my story and journey is not over, because I haven't had a baby yet. I'm 27 weeks. Hopefully, baby will be here soon, but not too soon, in the regular time that it's supposed to be here, because, you know, every day is a day by day, and we're still praying. Hopefully, everything will work out and we will have a baby girl come into May, early June. And so I'm going to leave this part of the story here, but I'm going to add in my birth story once that happens and add that to it. But I just want to say I'm always here as a listening ear advocate for infertility, IVF. There's so many of us going through that. And just because I'm having a baby now does not mean that I will not suffer from that in the future, or haven't. I obviously have suffered from it in the past, because there is second infertility that a lot of people talk about. They can get pregnant with their first one, hard to get pregnant with their second one. But yeah, please reach out. I would love to hear your story, because I think I want to put together something about women talking about their infertility IVF journey. This all started with me sitting at a table with a group of ladies that, for some other function, somebody asked me about, I think, my surgery and IVF, and come to find out, 2 or 3 other ladies at the table, one had went through IVF that just didn't work. Another one had to take fertility drugs to be able to get pregnant with her first child. 2 wanted to have kids. One of them had a myomectomy already, and the other one, she just wanted to have kids and didn't have a significant other at that time. So, and then there was somebody that had 2 kids. So there's always a seat at the table. There's always something going on. But I'm going to leave it at that now, and I'm going to say I wish you well. Hopefully you learned something from my story, and definitely reach out if you have questions.